As a CT, I see it is sharing again with only half the page.
Okay, I'm going to try again.
Thank you.
Yes. How is it now?
Perfect, thanks.
Awesome. Let me turn my camera on actually, and then I'll just be on the screen. Awesome.
Just share your presentation again. No, I see me. I don't see the presentation. There we go. Perfect. Okay, wonderful. So we can start at 2.
Wow.
Wonderful. It is 2 p.m., so we are going to get started. Welcome, everyone, to the Tempo Wellness Discussion Group. My name is Wilmarie Joubert, and I am a Tempo Wellness Coordinator for Bestmed. We are proud to be hosting these Tempo discussion groups and to be providing our members with more support services. Today, we have invited Psyched to host a discussion group on mental health, lifestyle, with the focus on anxiety. We would like to encourage all our participants to please ask questions using the chat box, and I will relay them to our speaker to answer, or at the end of the session, we will unmute all our participants to ask questions. For more answers to your questions or to get into contact with site, please feel free to email us at tempo@bestmed.co.za. So let me introduce our speaker to you. Today, our speaker is Asiti Sejusengu. She is a registered counseling psychologist and a psych-affiliated therapist. Her work entails providing comprehensive counseling and psychological support to individuals and families with various psychological concerns, including pre and postnatal counseling, grief, and trauma therapy. She is passionate in offering individual therapy interventions derived from either cognitive behavior therapy, person centered therapy, or narrative therapy. Thank you and welcome, SCCT. We are so looking forward to hearing what you have to say to us today. Please unmute. Sorry, SCCT, I see that you are muted.
So sorry about that. I hadn't realized. Let me just go back to my presentation. Awesome. Can everybody see my screen? Is it showing nicely?
Yes, it is.
Awesome. I'm looking forward to engaging with everybody at the end of my presentation, and I will be looking forward to answering all the questions that you may have to the best of my abilities. So should I just go ahead and start?
Yes, please feel free to start.
Okay, so as Wilmary has said that we'll be discussing anxiety today. So a quick overview of what we'll be talking about. We're going to look at what is anxiety, what is normal anxiety versus anxiety disorders. We're also going to have a look at the types of anxiety disorders that we have, the diagnosis of anxiety, how we get to diagnose people with clinical anxiety. We're also going to look at the symptoms of anxiety. And I've also included high functioning anxiety because I know that it's quite prevalent in the world that we're currently living in now, even though it's not necessarily a disorder. And then we'll talk about the overcoming of high functioning anxiety, as well as an overall treatment of anxiety. So to begin with, I just want to answer, what is anxiety? So in general, anxiety is a universal emotion, which is much needed to function in our day-to-day life. Without it, survival will be nearly impossible. So it's a normal reaction to stress. And according to our psychology Bible, which is the DSM-5, anxiety is excessive worry and excessive anxiety, the apprehensive expectation of something bad happening, and this must occur occurring more days than not. So you must have it more times than not, and for at least 6 months. It must be about several events or activities such as work, school, performance, or just a general life. And so anxiety is not a bad feeling, but it can make everything else feel bad and scary. It's a part of our fight and flight mode, and it's a way of our bodies responding to protect us from anticipated danger. Past experiences as well as trauma can often make us hyper vigilant, causing us anxiety, which it thinks everything is scary and tries to protect us from it all. So to get to know your anxiety and what triggers it, it's very important, and then slowly challenge it and try to relearn how capable you are in facing the small as well as the uncomfortable things. And so I'm going to play a little video that explains in detail what anxiety is, and then we'll continue.
There's no way I'm going to pass this exam. I don't even want to show up.
I was so uncomfortable at that party. It was hard for me to breathe, and I got all sweaty. I had to leave.
I won't go to sleep or leave the house unless I've made sure the stove is off and the doors are locked. Sometimes I do this 3 or 4 times.
I have to get to the airport 5 hours early. You just never know what might happen. These are the voices of people who have experienced anxiety. Anxiety is a common reaction to life events, like taking a final exam or speaking in front of a crowd. But when it becomes really uncomfortable and makes day-to-day life hard to live, then it's a problem, or even what we call a disorder. I know. I've lived with anxiety for a long time. My own anxiety feels like it's about everything. I worry about so many things in so many ways, and it impacts my life big time. I stress about things that are about to happen or might happen, and it means I can't really focus on where I am or who I'm with. Sometimes my heart pounds, I speak really fast, and I kind of snap at people. My family gets really frustrated. When it's really bad, I have a knot in my stomach all the time. I can even feel depressed, and then I just want to be alone. I feel like if I do something, I'll screw it up or something will go wrong. So a lot of times, I'd just rather avoid it all. I feel so much better staying home and maybe having a drink. Turns out, anxiety is a very common mental health symptom. It can be the main sign of generalized anxiety disorder, which I have, or social anxiety disorder, which is when people have a fear of being in public or meeting new people. For those of us with social or generalized anxiety disorders, it's really difficult to live the way we want to live. Some people have anxiety about really specific things. They are afraid of heights, snakes, spiders, or something else. These are called phobias.
Sorry, not sure what happened.
And when people avoid these things, anxiety mostly stays away. But when people can't avoid their phobias, it is a real problem. Some people experience anxiety and post-traumatic stress disorder or obsessive compulsive disorder, which can make people really overcome with anxiety. In these conditions, anxiety can be so intense that people are at risk for suicide, and they use alcohol or drugs to cope. And sometimes their lives feel like they come to a halt. I'm one of the lucky ones. My doctor told me how to get the treatment that would help me, and it did. I understand now what my anxiety feels like, when it happens, and what I can do about it. I learned some great coping skills, and even just naming it keeps it in perspective. Sometimes my anxiety can still get pretty big, but it doesn't seem to last quite as long as it used to. My anxiety was treatable. For most people, this is true. You can get your life back to where you want it to be. I know. I've got mine back.
Awesome. Any questions from the video? Did anyone resonate with the description or the definition of anxiety? I think we can just write our answers down on the chat box.
There's a lot of thumbs coming up saying they could resonate with the answers
Yeah.
with the video, yeah.
Awesome.
And they say yes, yeah.
Yeah. Okay, awesome. So now when we talk about normal anxiety versus anxiety disorders, occasional anxiety is a normal part of life. And then also normal levels of anxiety, they lie on the one end of the spectrum and may present as low levels of fear as well as apprehension, whereas clinical levels of anxiety, they fall towards the other end of the spectrum. And that's where we can now talk about diagnosable anxiety disorders when it occurs in the levels that rise enough to rapidly decrease our performance at work, at school, or at home, and cause us impairment. And so what people think anxiety is usually is like one side of the other coin, like feeling anxious or maybe feeling nervous or worrying about something. What anxiety actually is a multiple of things, and it presents itself in multiple of ways. One of them is having trouble concentrating, trouble sleeping, having obsessive and intrusive thoughts, uncontrollable feelings of worry, increased irritability, restlessness, and a feeling of being on edge, which can often also give you insomnia, the avoidance of feared situations, loss of appetite, or sometimes even eating too much. It can also show up as feelings of guilt and shame and a ton of other physical symptoms, which we'll get to in a moment. And so the types of anxiety disorders, these are ones that need a medical or a mental health practitioner to diagnose. We have social anxiety disorder, which is essentially marked by the fear or anxiety about social situations in which the individual is exposed to. And they often worry about being scrutinized, being humiliated or rejected, or causing other people to be offended. And so what they often find themselves doing is that they will rather not go to any social situation. And then secondly, we have generalized anxiety disorder, which is one of the anxiety disorders that is quite prevalent and also mostly diagnosable. With generalized anxiety disorder, it's still marked with excessive worry about a multiple of things. It's often uncontrollable. People will suffer from generalized anxiety disorder. We call it GAD. They get easily fatigued. They have sleep disturbances, and it should always cause some significant distress or impairment in just your day-to-day functioning as a human being. And then we have specific phobias, which are marked with the fear or anxiety about a specific object or situations. And popular ones are people who are scared of heights, flying, animals, or even maybe seeing blood. And the fear of this object or maybe situation is almost always provoking an immediate sense of fear, of anxiety. And then we have a panic disorder, which is also marked with an excessive worry that is often recurrent or unexpected panic attacks. A panic attack is an abrupt or a surge of intense fear and discomfort that reaches its peak within minutes. It can occur from if you were just calm, maybe asleep, or maybe just taking a walk, and then suddenly you get hit by a panic attack. Or sometimes it can result from having you being fearful or anxious about a specific something. And so the symptoms of panic disorder is often like a chest pain, heart palpitations, sweating, choking, nausea, and feeling dizzy. And a lot of time people usually think that they're having a heart attack or they are dying. And then we have obsessive compulsive disorder, which is a presence of obsessions as well as compulsions. And it can be very time consuming. And I think in the video that we're talking about how they made an example of how people often can leave their homes without double checking and triple checking whether they've switched off the stove, the iron, whether they've locked the doors. They have to do it a multiple of times to make sure that they actually, they can trust themselves that they've done the specific item. And sometimes I find that people will take pictures of saying, because they don't trust that they've done it, they will take a picture. If I don't trust myself that I've switched off the stove, I'll take a picture of the stove just so that during the day when the compulsive or obsessive thought comes up of questioning whether or not I did it, I can just open my phone and have a look. So those are some of the behaviors that we see from people with OCD, quite repetitive behaviors. And also they might have like mental acts that they do that are aimed at reducing or maybe even preventing the anxiety. So you find that people can't go into an exam or into a meeting unless they've breathed in and out 10 times, or maybe they've flipped their pens into specific ways. Things that when you look at it necessarily, they don't make sense to you, but for them, it's quite comforting. And then next up, we have separation anxiety disorder. That's when you have a fear of being separated from family members, and we see this necessarily in children, and as well as teenagers. And then lastly, we have substance or medication-induced anxiety disorder. That is when the anxiety or the panic attack or anxiety attack is induced by the having been intoxicated with medication or substances. And it's quite important in the clinical picture that there must be substance or medication in the clinical picture. So the evidence is also important to be found that supports that symptoms of the substance or medication-induced anxiety disorder were present either during or slightly after the substance or the medication was introduced. And then the diagnosis of anxiety. Before I continue, does anyone have a question or something that they want to say? I can open up the floor quickly for comments.
I'll quickly go through the chats just to see. There is a question that you can answer.
Okay.
My son has anxiety. He had his first panic attack at 7. He has been on herbal anti-anxiety since then, and thankfully not had a panic attack in 3 years. He was diagnosed at 4 with textural and sensory disorder and a mild form of OCD relating to the sensory disorder. Occupational therapy and anti-anxieties have been helped tremendously. He is now 16. Occupational therapists say that the greatest thing was a dog. However, they kept his anxiety slightly in check.
Sure.
How fast can anxiety medication take to be effective?
I think it depends. I think it depends on the severity of the anxiety, which we're about to talk about just now. And sometimes we struggle to answer that question because people or children respond differently to medication. It also depends on the type of medication that you are on, and the frequency of your of the consumption of that medication. But usually if they are in therapy and they're working with a psychologist, anxiety can often be managed through specific coping mechanisms that can be implemented. And it usually, if it's a child, it usually involves the participation of the entire family so that they can have ways to reduce or even prevent triggers that help them manage with the anxiety. But I think that it is a good thing that they are on medication. And I think once maybe they have noticed that it's not working as well as it used to, that's a conversation that they can then have with their, if maybe the medication was given by a psychiatrist, they can have that conversation together with their psychologist. So a psychiatrist as well as a psychologist.
Thank you.
I hope that answers that. Awesome. There are no other questions.
Let me see. Please broadly elaborate on panic disorder.
Okay. Panic disorder, it's usually a recurrent and sometimes what we found with panic disorders is that they don't necessarily have any triggers. That's why I spoke about how it can happen whether you were anxious or maybe in your calm state. And sometimes post-traumatic stress disorder is usually a differential or maybe a comorbid with panic disorder. And it's also something that is hard to diagnose because I think a lot of medical professionals struggle with managing it without medication because there isn't necessarily any medication for specifically panic disorder. So all of it falls under the anxiety disorder. So the same medication that one would use for anxiety would be the one that they use for panic disorders. So usually when we're treating people with panic disorders, a lot of breathing work goes into the management and the treatment of panic disorders. And I think recently they have come up with a framework, a theoretical framework that comes from mindfulness, because the research has shown that panic disorders or people who struggle with panic disorders often respond very well to interventions that fall under that theoretical framework of mindfulness.
Makes sense. Yeah. Calming yourself, being in the moment, grounding yourself.
Yes.
Makes sense.
Awesome.
So maybe we can continue with your presentation, because I think a lot of the questions will also be answered in your presentation about, who can diagnose you and the severity of it, and then the treatment of anxiety.
Yeah. So in terms of the diagnosis of anxiety, when diagnosing anxiety, it's very important that we have a comprehensive evaluation of the symptoms in terms of the clinical picture. And it's also very important that we be aware or cognizant that there might be a differential diagnosis, because anxiety can often be a principal manifestation of other mental illnesses or somatic illnesses. And so anxiety reactions are important indicators of a possible threat to our homeostasis, and it can be considered a mental health issue when it rises in the absence of no threat, or maybe in ways that are not appropriate. And also it's very important that it must keep the individual from leading a normal life. So meaning that their functionality must be affected. And then as well, anxiety disorders, they elevate the risk of developing other mental illnesses. For instance, substance use or abuse, and recent studies have also shown that it can also lead to cardiovascular diseases. And so before I continue, I'm very interested to ask this question, whether or not the people who are listening and attending, why do you think that anxiety disorders would elevate the risk of developing substance abuse or substance use or any cardiovascular diseases? Just out of curiosity.
Okay, let's see if there's an answer in the chat box.
Awesome. It was mentioned a bit in the video that we listened to. So
Coping mechanism.
yes, definitely.
Prolonged stress impacts one's self-soothing behaviors.
Yeah.
You can have a temporary fix. Would try to cope. You see it as a crux. Calms you down.
So are they the people who are answering are specifically relating to the substance use and abuse?
Yeah, it's a form of an escape.
Yeah. And what are they thinking? What are you guys thinking in terms of your cardiovascular diseases? Any thoughts around that?
I would think my personal opinion would be if you have an increased heart rate because of the level of anxiety that you're experiencing, I can't imagine that would be good for your heart. Also, the hormones that's released from your brain into your heart, it can be damaging. Yes, hypertension, impacts of the heart rate and pressure, high BP, stress puts you under a lot of pressure on your heart and your nervous system.
Absolutely.
Eating unhealthy foods to comfort you, uncontrollable blood pressure.
Yeah.
That is what all our members are saying.
Absolutely. Yes, that's exactly what it is actually. I'm happy with that answer. And so the symptoms of anxiety, physical symptoms, they often include like your head, your chest, as well as your stomach. And so when we're talking about head-related physical symptoms, we're talking about brain fog, memory problems, as well as numbness or tingling. We also have headaches. People will complain about feeling dizzy, and as well as insomnia. And then in the chest area, people often complain about their chest pains, heart palpitations, inability to breathe, hypertension, as well as sometimes almost like they would describe like they have like a knot in their neck here that they are unable to shake off. And then in relation to your stomach, anxiety usually shows up as indigestive issues, nausea, stomach aches, and we see that with the stomach aches and indigestion. We see that a lot with the teenagers or children. Acid reflux can often be a physical symptom of anxiety. And then on a psychological perspective, in terms of how the symptoms affect you, start to overthink, you avoid specific people or specific places or specific tasks. You have trouble with your concentration, as well as insomnia. And so what anxiety may feel like in continuing with the symptoms, so dizziness in terms of your physical, mental way is overthinking, and emotion, you might be like easily irritable or irritated, tummy issues, mentally feeling overwhelmed and therefore crying, tired, the brain fog, as well as guilt, the headaches, trouble concentration, a little bit of depression, sweating, intrusive thoughts or compulsive thoughts, fatigue or exhaustion, muscle tension that we often see people complaining about a muscle on their neck that goes down all the way on their shoulders as well as arms. I've even have patients or clients who present with like intense numbness in their arms where even the arm is no longer functioning properly, and they've done multiple of scans or x-rays and nothing is being seen. But once we start working on treating the anxiety, we start to see that the function is coming back. People also struggle or suffer from negative automatic thoughts, impatience, shakiness, or being stuck on the same thought, and some anger may also be present. And so anxiety scale, this is what we look at before we can diagnose and make a treatment plan or start thinking about possible treatment plans, or whether or not as a psychologist, we need to refer either to a psychiatrist or maybe sometimes even a general practitioner. So on a scale of 1, which is a minimal anxiety, those will be like small amounts of worry or anxiety that you're still able to get things done, you're still able to complete and focus on tasks, you have little to no physical symptoms. And then mild is when you are anxious throughout the day, but maybe not all day. I'll find that sometimes people are saying, I'm very anxious in the morning, just before I get to school or before I get to work. And then once they start getting on with the tasks of the day, they see that the anxiety alleviates. Some changing in concentration and sleep, but not too much. Stomach ache and maybe a little bit of muscle tension, that would be our mild. And then moderate, you are anxious most of the day. There are changes in your sleep, appetite, concentration, there's a little bit of avoidance, and you feel panicky most of the time and most of the day. There's headache as well as fatigue. And then when it's now severe, that's usually where we now say, okay, if maybe we have been treating you for a minimum of 2 to 3 weeks into using psychotherapy, but you're not responding very well, or maybe you are unable to manage the coping mechanisms that we're helping you with, then we can now refer for further psychiatric evaluation and perhaps even the consideration of medication. So that would be number 4 in severe. So that's when you're anxious all day, feeling of breathlessness, chest tightness, digestive issues, unable to focus, a sensory overload and isolation. And all of these things are obviously impacting on your day-to-day functioning. And then lastly, debilitating anxiety, severe anxiety all day, panic or anxiety attacks, where you can't function, intense physical symptoms, feeling paralyzed, meltdowns, obsessive thoughts, feeling unable to continue. And if it gets to this point, another option of now being admitted to a psychiatric clinic can often be also, we can engage you on that. And so this is the scale, the general scale that we use to now look at the diagnosis of anxiety. And so high functioning anxiety, as I've mentioned previously in my introduction, that it's not necessarily a medical disorder or a medical diagnosis, but we have found that it actually impacts a majority of people who are functional. And people who are not, the high functioning anxiety is not necessarily people who are, it impairs their ability to focus. It's not necessarily impairing their relationships or their ability to just show up. So research has shown that this type of anxiety affects mostly women or moms. And I'm curious to just check in a little bit why they think that is. Why do you guys think that it may affect or mostly affect women and moms? Nothing on the chat box.
Many roles that they play, so many things to do.
Yeah.
A birth of a baby, a woman is more emotionally involved. They worry about their kids. We are responsible for everything in our lives because we do everything for everyone.
Yeah. That's exactly
hormonal changes. We like control. We do everything.
I think the control is such a big factor. And I'm saying this because often when you are having conversations with your clients who are women, they find that they cannot trust anyone in their circle to be able to delegate and relax and trust that the functions or the tasks will be completed in the way that they would want them to. So you find that they have more tasks on their plates, or maybe also with very little support. Yeah.
Yeah, this one member said, women have to take care of everyone. It's the superwoman syndrome.
Yes. Superwoman syndrome. I like that. Yeah. And I often talk about how if you behave like a superwoman, the people around you are often going to treat you like one. So if you behave like you can do everything all at once and you can juggle all the balls all at once, all on your own, usually people sit back and relax and um, assume that you've got the capacity to do that without realizing the impact that it's having on you. And I think also women struggle with asking for help, to admit that I'm not coping, I'm not doing well, I can't do this. And so that's why then they might be the ones who are affected by high functioning anxiety.
I've also heard that sometimes women struggle to realize that men kind of need that little bit of, can you please do this for me?
Yeah.
Because we tend to, we see the dishes, we see the trash that has to be taken out, we see the floors have to be mopped, and we kind of expect that our partners also see that and that
Yeah.
they will then help us. But sometimes we have to kind of just give them that little nudge to say, I need help. Can you
Yes.
help me to do
Yeah,
this?
definitely. Definitely. I think it's also what you're just saying now. It reminds me of the fact that how sometimes we can expect people to read our minds, and to also like, why can't they see that A, B, C, and D needs to be done? And so therefore you expect them that they will read between the lines as well and do tasks exactly the same way that you would perhaps do them. Um, so yeah.
There is a question here that says, my wife was very ill for some time, and I was the one who was nursing her back to health. But now
Mm,
the problem is that I no longer connect with her because I become numb when we are together. I have a brain fog and I don't know how to remove the scars I saw on her when I was nursing her. What should I do to regain my health and my health mind again?
sure. Um, I'm so sorry to hear about that. I can't imagine how hard that must have been for you as well as your wife. But well done for taking care of her. Um, I think that's to be commendable. So I think the first thing that I would suggest you do is to speak to a counselor or maybe even someone, a psychologist, whoever you have in your um, whoever you have access to, because I think if that's where you're at now, it might be a little bit helpful for you and beneficial for the both of you for you to attend therapy. It's possible that you are struggling with having seen the scars that were on her body. Sometimes that can cause us to be a little bit traumatized and be unable to unsee what we saw, and so therefore having to live with her on a daily basis might be a trigger. So I do think that it's important for you to just get a quick consultation with a psychologist or a counselor or whoever you have access to who may be able to assist you in that. And then there's also no shame in just talking to your wife about it, and then perhaps trying to, if there is a need for you two now for together to go for couples therapy, that might be beneficial in terms of reviving the relationship. Um, and returning it back to the healthy state that it once was before you had to nurse your wife.
Thank you.
Okay. And so in continuation with our high functioning anxiety, so high functioning anxiety usually happens when an individual shows up, but it's always at a cost to them. It costs them their peace, it costs them their time, because if individuals with high functioning anxiety, they tend to put on their plate more than what they can bear. They usually take more responsibilities, as I've just discussed, than what they can actually afford to do. And usually people don't really know that you are needing support, you are needing assistance without you having to communicate those to them. And so that's what at the cost to you means. And what research also states is that the root causes of high functioning anxiety is people pleasing, perfectionism, as well as procrastination. Procrastination in a way because people usually want to be perfect, they usually want to do things perfectly. They're not knowing of what people are expecting from you, what is expected of you. And so you project that they expect a specific level of perfectionism or a specific high level of intensity, as well as not necessarily knowing what the time frame is. You assume that people need it immediately, and so therefore you want to be perfect, you want to please them, as well as it might then start affecting your procrastination as well as your productivity. And so the two sides of high functioning anxiety, usually what people see, and this is what sometimes we call the duck syndrome, where you see the ducks above the water, they're so calm, cool, and collected, but underneath the waters, it's like quick, move. And that's usually like a nice description of what high functioning anxiety may be, because what people see, they see you being calm, and how you often might feel is the fear of failure. They see you as being high achieving, but how you feel is being a perfectionist. They might see you as organized, whereas on your own side, you feel like an over planner. They see you as active when you see yourself like you are procrastinating and often very overwhelmed. They see you as outgoing because you say yes to all the invites, you say yes to all the asking of, can you be the one to organize this? Whereas you are frequently feeling exhausted. And then people might also see you as very detail orientated, whereas for you, it's a lot of racing thoughts, wanting things to be perfect. And because you never know exactly what people are expecting, you tend to go above and beyond. And what others may see is you meeting deadlines. Whereas on your side, that's often felt like an inability to show up. And then sometimes people might see you as hardworking. That's why I made an example of saying yes to, I'll do it. And people often relax and say, no, so-and-so has it. Whereas it might actually be an indication of your poor boundaries. And so how do you then overcome high functioning anxiety? Firstly, it's important for you to recognize that you've got high functioning anxiety, and start having clear expectations of yourself and as well as others, to communicate. Like if maybe you were given a task, ask for clear expectations. When do they need it by? How long? How many papers or words are necessary for this particular thing? Who can you ask for help for? Who can you not ask for help for? And having clear boundaries as well, very strict boundaries, yet flexible, because you also want to be a teammate, but to make sure that you're not the only one who always has more to-do lists than the other people, who always says yes to all the requirements. If someone has to plan a baby shower, you always the one to say yes to that. If there's an event at work, you always the one to say yes to that. And having clear to-do lists so that your day is a lot more manageable, to know exactly what you need to do, when you need to do it, and how long, if you can, to allocate a specific amount of time that you then spend on each task. And getting decent amount of sleep is something that I think we often underestimate how important it is, as well as moving our body, not necessarily exercising or joining a gym or signing up for a boot camp class, but just like doing movements. It could be a walk, could be a dance, yoga, anything to just get your body moving. And so high functioning anxiety daily coping checklist. A quick body scan to relax, to soften any tension, which is usually on your shoulders as well as your clenched jaws. So relax and just soften any tension. So secondly, becoming aware of your thoughts is very important. So what is going through your mind? What are you thinking as you move through your day? Recognizing your triggers. What situation or triggers do you notice have an increase in your stress or anxious sensations? Repeating a mantra, or maybe saying, I'm a human, I can do this, and I'm doing the best that I can. Separating yourself as well, separate the anxiety from who you are as a person, to not saying my anxiety or I have anxiety, I'm an anxious person, rather than to distance it a bit, to say I often struggle with anxiety, to know that there's you and then there's anxiety, because anxiety is what you experience, it's not who you are. And also identifying the fear or the things that often trigger your anxiety. What is the fear that is rooted in the anxiety? And again, to breathe in deeply, noticing the expansion, and fully breathe out, extending your exhale, and you just keep repeating that. And then treatment options for anxiety. Before I go into that, any questions, any comments, anything that people can end? And also, if you have struggled with anxiety, how have you been coping? What's the best way that you have found works for you?
Okay, let's see what our answers is. I must say I like a lot of what you're saying because it links to our emotional wellness journey that we have on Tempo. And there's so many videos that is specifically designed to help us to, decrease our stress levels, breathing exercises, meditating, mindfulness exercises that our members can do. So I like that a lot. So, all right, let's see. We have here lack of boundaries. That one hit. Exercise helps me to cope. I
Mm,
go for it almost every day. Wow, your anxiety is what you experience, is not who you are. And I think that's a very important identity comment there, from a
mm,
narrative therapy perspective,
yes,
especially.
yes, yeah.
Um, Breathe. That's a good one. Medication only, meditation, um, words of affirmation,
Mm,
communication really helps based on boundaries and to
ye-
do lists, reading and running, mindfulness, breathing exercises, and yoga.
yes, yeah.
Um, Balloon dancing helps me because I can give over control in the dance and just glide along without worrying about the
Mm,
outcome.
mm,
Ballroom dancing.
yes.
Um, you have
I
to
was
re.
wondering what balloon dancing was. I'm going to
Yeah, I'll tell you about it. Reframe your thinking. Acknowledge that you are having anxiety. An episode. Um, when I feel anxious, I take off my shoes and stand barefoot on the grass.
Yes,
Today,
that's
I plan to
good.
go to the beach after work and put my feet in the water. It grounds me.
Yeah.
Oh, can we join you?
Oh, love that.
um, Let me
Is that
see.
all?
There's quite a few more physical exercise. Prayer, running helps me to really be calm.
Mm,
Listening to music, live in the moment, slowing down, healthy diet, a good night's sleep, and exercise.
yeah. I
Yeah.
love all of those. Sure. All of those are good. And I think even for people who don't necessarily have a diagnosis of anxiety, I think that that should be the lifestyle that we are all ought to be living, so that we prevent or manage the little bit of anxiety that we might experience. Because it is normal to be anxious or nervous about specific things. It's obvious. It's normal for you to be nervous over a space of a couple of hours because something's coming up. Maybe you've got an interview or you're asked going if you are you have a very hectic meeting with partners or managers that's coming up. So if you've got or feeling a bit anxious or nervous about that, so all of these grounding experiences, the breathing, they often help. And listening to, if you go on YouTube and you just type grounding exercise, there's often like a little bit of music or sound that you can listen to that's often soothing for you to just do in the moment, to return to reel yourself back into yourself, and just be present in the moment and in the here and the now. So that's quite good. I love all of those. And so treatment options, psychotherapy, I had to put that number one because I am a psychotherapist. So CBT, or cognitive behavioral therapy, has been found to be the most effective form of psychotherapy for anxiety disorders, for anxiety as well as this depressive disorders. Lifestyle changes, the eating, the exercising, the walking, the just having fun with your friends and saying yes to invitations every once in a while, and making sure that you actually do socialize with people who give value and give meaning into your life. Meditation and medication, sometimes if it's severe enough, there is really no shame in saying, that you are on medication for the management and treatment of your anxiety. And I can never really stress this one enough, the last one, having a solid as well as sufficient support system. And it requires you to be able to say, I'm struggling, I'm not coping, can you please help me? Which is something that a lot of us, I think, especially in this generation, in this life that we're living now, we have almost, I don't know, we take so much pride in being busy all the time and having so much things to do, and coming home late and going into work early, and not exercising our support system and exercising or reaching out for resources that are available to us because we want to be know-it-all and do-it-alls. So I think it's very important that people start creating or establishing sufficient and solid support systems. And again, people are not going to know if you need help if you don't say it out loud. So I'm very sure that there are people, each one of us has someone or a few people that they can lean on in times of high stress or chronic anxiety, that we can just ask for help. And that's it for my presentation. So now I'll just open the floor for questions and comments. Yeah.
Thank you, Asasiti. I think the most important thing for me today is we should realize that having, if you just want to stop sharing, sorry,
Oh, because you stop
then
sharing.
for me it is realizing that, you know, having anxiety is completely normal. You also, because it kind of gets our body moving. I
Yeah.
have to I have to feel a little bit anxious because I have a deadline. So it gets me doing the work.
Yeah.
Otherwise, we will just lie on the couch. Um,
Exactly.
but when it interrupts my life, when it takes over my whole life and it just becomes who I am inside and out, then I know there's a problem. And then
Mm,
there's so many lifestyle changes that we should do
yeah.
to live that whole balanced life, to
Mm,
work but to play, to be
yes.
with our families, to share in community events, eating
Absolutely.
healthy, exercising,
Mhm.
all those things that
Yeah.
contribute.
Yeah. And I think people often underestimate how many people actually struggle with anxiety. So when you do admit and you speak to someone and say it, you'll find that often people will say, me too, you know, and that is often how you can start to now establish a support system and actually just normalize the experience of having anxiety and even having anxiety disorders. Because I think living in this fast-paced world where it's go, 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 do that, do this, accomplish this and accomplish that with very little support, it can often end up in an anxiety disorder. So I think it's very important that we always normalize it as an experience that's normal, as an experience that a lot of people struggle with, so that you're not feeling isolated from it all.
Definitely. So we have unmuted, we have allowed everyone to be able to unmute themselves. So if you
Okay.
have a question for Asiti, please raise your hand, let us call on you, and then you are welcome to ask a question. How do you assist a child who has anxiety as we approach final exams?
What grade is the child? So I think it depends on the grade of the child, because what I like to do with teenagers or kids who have the capacity for the capacity to understand what I mean by evidence of performance, is that you often have to bring their report for the year, their homeworks, their awards that they've given or they've gotten throughout the year, the test results. And if they've been doing well throughout the year, we can then use that as the evidence of their performance to now say, now towards the end of the final year exam, all you need to do is just finish well, because they have been doing well. So you look at what the evidence has been and you sit with them through it, so that they can then look at the tangible evidence to say, I have been doing well, and therefore there's high chances that I will continue doing well and finish well for the year. And I think if your child has the cognitive capacity to understand that evidence of performance, that's something that you can do with them.
I think for a grade 8, that should work.
That should work. Yeah,
Yes, great.
definitely.
So, John, I think you have your hand raised if you want to unmute and just ask your question.
Yes, thank you very much, and thank you to the our speaker, Mrs. Jose. Yeah, my
Yeah.
question is just to check. I mean, how do you do if you discover that somebody in your family or a colleague has this anxiety, and you are trying your best to say to the person, these are the ways to assist or change your behavioral patterns in order to improve. But there's no improvement. There's not even any indication that they are willing to change, and you end up
Mhm.
paying a lot of medical costs, taking them through psychiatrists for assistance, psychologists for assistance. But it's just a temporary assistance. Beyond that, they go back to their behaviors and attitude that put them back in the situation. How do you help in such a situation?
So you mean to tell me, John, that they are seeing a psychologist and they have a psychiatrist and they are on medication and yet there is no consistency?
Because the person, when they feel like they don't take their medication, as an example.
Oh,
Yeah.
sure. They relapse. Sure. Okay.
Yes.
I think I get you. You know, it's very important, John, to firstly just get an understanding that, you know, that analogy that you can take a horse to the river, but you can never force it to drink the water. It's very similar when we're working with people with mental health illnesses, especially with someone that you know you have spent huge amounts of money in getting them the assistance that they help both medically as well as psychologically, that you can't force their help on them, that they have to come to a decision where they want it for themselves, that they don't want to relapse for themselves. In as much as you could be desperate to help them and assist them, I think it's important for you to let go of that responsibility and come to a realization that people will only use their help once they are ready to use it. We can throw it at them, we can give them all the options, but if they are not ready to assist themselves and do it for themselves, it's hard to force it on them. So, yeah.
I mean, my worry as a follow-up, my worry is just the expense that you find yourself going through in terms of trying to assist. So that's
Yeah.
what is for me a worry, to say you are putting in resources to say, here is the money, go to this
Yeah.
person, go to that person. But people don't realize what you are putting.
Yes, I know what you mean. I mean, you can keep paying for them and just let them know that when they are ready, you are there as their support system, as their solid support system. And I think that's why I'm saying it's quite important for you to let them be the ones who are asking for their help, who are realizing that this is something that they need to do, not for you, not for their family members, or to be a good client or a good patient, but to do it for themselves. And so once that recognition or realization hits them, that's when we usually see consistency in the medication consumption, as well as the consistency in attending their sessions.
Okay, thank you.
Thank you, John. I think here's a very important question, Asiti. Is moderate to severe anxiety a driver for spiraling depression and burnout? How does these three interlink?
Is what?
Is severe or moderate to severe anxiety a driver to spiraling into depression or burnout? Or how does these three interlink?
So as I think, as I mentioned before, that usually anxiety is a primary indication of other diseases or disorders that often people struggle with. And so we do find that a comorbid of anxiety sometimes can be depression, and a lot of times actually can be depression. And so therefore, anxiety and depression can coexist at the same time. And burnout, what we have noticed with burnout is that people who have high functioning anxiety are at a much higher risk of being burnout. because of the amount of tasks that they take on, the amount of responsibility that they take on, the inability to ask for help or receive the help that they get from people who are offering it to them. And so people then land in become burnout. And so burnout usually affects you on a psychological level, that you become tired, you don't complete tasks, there's lack of motivation, which is also sometimes a representation of the existence of depression. And if you are a high functioning person or high achiever, that can often cause you to feel very anxious about the fact that you're not performing well, you're not adhering to the deadlines that are existing, and so therefore cause anxiety. So that's how I would think that those three are interlinked, and sometimes, and most times, we often find that they can be comorbids. And right now, I think because we're heading towards the end of the year, we are seeing a lot of people complaining about NDF fatigue and being tired. There is a little bit of burnout, and so therefore the anxiety as well may start to kick in, as well as depression.
Thank you. Yeah, that's very important to know.
Yeah.
We have another hand raised. Luyolo, if you are ready, you can unmute and ask your question.
Hello, thank you so much for the informative presentation. I just have a question. As a clinician, how would you interpret a person who has anxiety only in maybe one specific aspect of their lives? Say the person only experiences anxiety in the romantic context, whereby they get too anxious when they have to go approach a person, and even when they have to become intimate, there's that level of anxiety as a male figure, and which then leads to lack of arousal and all of that. How do you approach such a situation?
Sure.
Thank you.
Thank you so much for your question. I think it would be, I would give an incomplete answer because I think background information or historical background is quite an important factor that plays a role in our attempt to create a treatment plan. So if you have issues with performance anxiety or romantic, when it only affects you on the romantic side, I would, as a clinician, be interested in your history of romantic relationships, as well as the comments and your experiences in your romantic relationships, and try and find if there is perhaps like a root cause that can be found either from your self-esteem or sometimes even the comments that you grew up hearing. And I think also sometimes it might be because of the content that you are watching or listening to that can affect you, because there's already an existing expectation of how the level of your performance, where your level of performance should be. So I think all of those things would play a role in the creation of the treatment plan. And so therefore, I don't have a specific answer. I think that it would have to explore the background and the historical information to get to that answer.
All right. Thank you so much.
Yeah.
I think what you just said, it created this picture in my mind, of a tree, and the flowers or the fruit sometimes is the symptoms that we experience in our lives. But sometimes we have to dig so much deeper to find what is the root, where is our tree planted in, and where does the nutrition for this fruit that's not a fruit that we would want in our lives, where is it coming from?
Yeah.
Because like you said, the history, maybe you were hurt once by your partner and now you are carrying those fruit, these scars that's
Yeah.
creating anxiety. So thank you for that, Astine. Peliwe, I think you have your hand raised.
Hi there. Thank you for such an insightful presentation. I would like to know, what is cognitive behavioral therapy, because you mentioned it as a therapy that can be used to treat anxiety. What does it entail? What kind of activities are involved in the whole therapy? Thank you.
Okay. Not a problem. Thank you so much, Piliwe, for your question. So, cognitive behavioral therapy is a school of thought or a theoretical framework or a theory that psychologists usually use in the treatment of depression and anxiety, as well as other disorders or mental health illnesses. So, cognitive behavioral therapy, essentially what it is, it's all founded on the basis that it's very important for us to challenge our cognitive thoughts. So, it works from a cognitive perspective. So, what are our beliefs? What do we believe about ourselves, about others, as well as the world? And how do those impact the beliefs that, our behavior? And so, what do you think about yourself? What do you think about others? What do you think about the world? And therefore, how does that impact the behavior then you then start to exhibit? And so, it's founded on the belief that we have to do small behavioral activating therapies or interventions where we're not only just challenging your on your cognitive level in terms of your thoughts, but we're giving you new ways in which you can then behave. So what are the alternative thoughts? So if you believe that the world is bad or I'm undeserving of love, what is the alternative to that? What is the belief of that? Where did it come from? And how do you then change that thought so that you can then bring out a new behavior from it? So it's quite extensive. It's usually a long-term therapy theory that we work with clients just to activate their behavior so that we can change their behavior. But we don't change their behavior from a surface level. We have to first challenge the thoughts from the cognitive level and then work our way down to the behavior. And then we find alternative ways of behaving. I'm simplifying it, but it's much more than what I've just said. And I hope that answers you. So it's small activities that we activate behavior, we're challenging the thoughts, we're reframing the thoughts, and we're finding alternative ways of thinking and therefore alternative ways of behaving that are now not maladaptive, but are much more healthier, a healthy belief system, a healthy cognitive thoughts, a healthy thinking that would then give us a healthy ways of behaving.
Makes sense. Liliwe, did it answer your question?
Yes, she answered it very well. Thank you.
Wonderful. Kishore, I see that you have your hand raised.
Thank you for actually taking my call. I really appreciate that. And I just want to find out in terms of from a psychological point of view, if this condition had arisen out of your work. In other words, I'll just give you a hypothetical example where the manager had been treating you so badly and there was victimization, and you can prove there was victimization involved, and then there was ill treatment at the work, and there's everything that goes on the negative side that you've been experiencing at work. Can this be, I mean, now that you have gone through the treatment and the treatment is maybe 4 months, you are on the medication for the anxiety that you have, and it's actually continuing. Is this reportable to the Workmen's Compensation Act, if I may ask?
The what? Compensation Act?
To COIDA, Compensation
Oh.
for Occupational Disease Act. Is that reportable now?
I am so sorry. I don't think I have the expertise to give you an answer to that. I'm not clued up in terms of that particular act. My apologies.
Okay, thank you for that. All right, that's fine then. And
Okay.
then just the last thing there, I've come to the realization that, in your day-to-day activity, what you cannot control, don't bother about it. Just go on. Thank you.
Yeah, thank you for that. Thank you so much.
Thank you. Okay, Pakama, I think you have your hand raised. You can just unmute.
Yes, thank you so much. Thank
Hi.
you for having me. Thank you for having me. Thank you for such a wonderful platform. Sure, I'm going to try and be quick. We're actually struggling. My wife was recently diagnosed with major depressive disorder with anxious distress, recurring panic attacks, and multiple psychosocial stressors.
Yeah.
And I've noted that it mainly affects her work, or shall I say, I think it mainly emanates from her work environment, and it's affecting everything in our lives, including matters here at home. We have 2 girls that we're raising. She just cannot function. She just cannot participate in anything. She's been seeing a psychiatrist, psychologist, and today we just had another session with a psychiatrist, as well as an occupational therapist. She has been, well, I think treatment is going okay so far. Just that today the psychiatrist has said to her that she can now go back to work. And I feel that it's just caused her to just tumble all over again.
Sure.
And I just don't know how to help her move forward with this. And at the same time, she's very fearful about, the threat of the loss of her employment. But she's really struggling. She wants to go back, but she just has these relapses when we start talking about work and work environment. Her difficulty is quite different from what the gentleman had just recently called and mentioned, because there's no abuse in her work environment. The fact of the matter is just that they are really overloaded with work. She's a teacher. She's teaching about 9 subjects, and that is, I feel, is absolutely ridiculous. It's a private school, but they are all overloaded with work, and I know she complains that they're not heard. Whatever they bring to management, they don't listen. They don't attend to the whatever concerns that they have. So I think, the issue of her going back to work, well, she has to return at some point, but I don't know how it needs to be handled.
Sure.
I have a fear that she's just going to get worse, and I have a fear that she may even get a stroke or any of those serious, illnesses. I don't know. I'll wait for your comments.
Sure.
Thank you.
Sure, that's so profound, and such a complicated case. And I'm so sorry that your wife is going through all of that. Usually, if she works as a teacher in a private school, I'm not quite sure what their system is or some of their policies may be. But sometimes private companies as well as public companies have something that they call basically like an incapacity, where if there is a diagnosis from a psychologist, a diagnosis from a psychiatrist, and the person is on medication, and there is proof that this person has been absent from work for a multiple of weeks or months, and there's evidence that supports that psychosocial, psychological stresses emanate specifically from this environment, and it could be linked to A, B, C, and D, for example, the amount of work that they have. There can be a letter that could be written by the psychologist. I think you would have to then just chat with the psychologist and check if they would be able to support you with that, where you just talk about for a minimum of time, maybe as soon as she comes back, maybe for a minimum of 6 to 3 months, for 6 weeks to 3 months, where there are some of their responsibilities are taken off from their plate so that they can readjust themselves back to the working environment and help increase their capacity to handle specific amount of work that otherwise they are not necessarily currently having at the moment. So I do think that private companies as well as public companies or government companies have such a thing that exists, but I'm not quite sure what it's termed. But it relates to their capacity or incapacity. So I do think that have a chat with your psychologist and see if maybe they can write this letter of motivation for some of the responsibilities or subjects to be taken off her plate, just so that she can transition back into the work environment at a level that will not make her relapse. Yeah.
Okay, thank you very much. I'll follow up on that.
Sure.
And maybe with the, just easing into it, she will rediscover what she loved about teaching in the first place. That's not focused on just the stress of it and the anxiety of it.
Yeah.
Thank you,
Okay.
Bakama. Thank you so much for your question.
Yeah.
So there's quite a few questions in the chat box, and we still have a little bit of time, so I'm going to relay them to you. Are there any specific dietary choices and nutritional habits that can influence mental well-being and resilience against conditions like anxiety, burnout, and depression?
Are they what that can influence against having such disorders?
Yeah, dietary choices and nutritional habits that can maybe, because I know a lot of foods that boost your brain and your health, and maybe reduce anxiety and so forth. But
Yeah.
all our members all have access to visit a dietitian as part of the Tempo
That's
benefits.
who I was
So
going
that
to
would
refer
be
to.
probably the best person to ask. Visit the dietitians, ask them who can, what foods can you incorporate to relieve anxiety and so forth. But maybe you also know of something.
I know for sure. I was going to refer to a dietitian or a nutritionist because I think that would then be their area of expertise and they would know exactly what that person needs. And I think it's also important that I mention that as mental health practitioners or medical practitioners, we work a lot on an individualized plan or treatment plan based on the person's history, their access to resources, access to support systems. And so we tend to, whatever recommendations that we usually give, they're usually based off of that. So there are questions that I won't be able to answer because I don't have all the necessary information. However, what I do know for sure is that research has been showing that the amount of alcohol that you drink can increase your level of anxiety and depression. So that's the only one I can comment to because that's something that I've come up with in terms of our psychological journals.
Interesting. Thank you. Thank you for that. Um, what can be suggested to help one switch off at night when you want to sleep rather than to resort to medication? My mind stays busy with thoughts around various things, and I may have experience or have an uncertainty about and could affect my and my family's well-being.
Sure. Okay. So depending on how severe it is, if it's something that's mild or moderate or just really low, we usually suggest that you must eat your dinner a minimum of 2 to 3 hours before you go to bed. So that to make sure that your digestive system is well rested by the time you go to bed. It's also very important to not have any screens, that's your laptop or your phone, an hour before you go to bed. So switching off your screens, that's something that is quite important and recommended. And then also we usually also talk about the experience that you can do whilst in bed. So there is an incredible YouTube link, little video that helps you sleep. So you play that one in your body. It's called a body scan or muscle relaxation, where it talks you through what you need to be doing. And my experience with it, and I've suggested it with a couple of my clients, and they always come back with a positive feedback. So if you go on YouTube and you say progressive muscle relaxation just before bed, it's quite a nice relaxing thing that you can listen to, and it talks about clearing your thoughts, tightening specific muscles and releasing them. And by the time you're done, you're feeling so relaxed and so focused and so centered that you can then be able to quiet your mind and be able to fall asleep. Obviously, it's not going to be something that instantly works on your first night. It needs a couple of nights and practice for you to do, but I have found it to work incredibly. And another one that the body scan, where you try and think of what are your thoughts, how are you feeling, how's your heart, and if you can, journaling some of those thoughts, journaling some of those symptoms you're experiencing, and journaling is actually such a powerful tool that we use in our psychotherapy spaces. So those are the few things that I would suggest before bedtime.
Thank you. I was about to say, when my mind feels overwhelmed with a lot of, like, I have to remember this and I have to remember that and I have to do this, then I tend to have a book next to my bed where I write everything down just to get the thoughts out, and then I can sleep much easier. Lillian, I see you have your hand raised. I'm just trying to mute.
Thank you for informative presentation. My situation is you can't hear.
I can.
There we go. Sorry, I found the person who was
Okay.
unmuted. Lillian,
Okay.
yes, please.
Thank you for the insightful information. My situation is very tricky. I don't know whether it's depression or not. What happened is my husband came back from work before there is 3 visas. They were busy. And from there, when he came back, we couldn't talk properly. And then I said to him, maybe he needed some rest. And then my movement for some time. Then after realizing that this is serious, and we rushed to the doctor, and then we was diagnosed with several sicknesses. But the patient to that doctor, it's a family doctor, was what happened. I was stressed, and I didn't know what to say because I wasn't there when he came back from there. Then after that, we got treatment for that day, and then he became better. Then he explained to the doctor what had happened where he is working as a teacher as well. And then from there, we were supposed to go to Limpopo. We went. When we get there, he relapsed again. I take him to the doctor, and then from there, for 2 full weeks, when I'm asking him now, he said he doesn't remember anything. And then when I ask him, are you stressed? What's going on? It's like, no, I'm fine. But you can see he doesn't want to do anything. He only enjoys sleeping. Even when I say, let's take some walk, he doesn't want to do it. He's inactive. But I don't know how to help him. And I'm losing patience. I don't know if that is depression as well.
Okay, so I thank you so much for your question. I heard bits and pieces of what you were saying because I think the sound was a little bit bad. I don't know if you, Wilmarie, did you hear the complete answer? Question, sorry.
I also caught bits and pieces. Yeah. So I know.
But am I clear now?
Sorry?
Am I clear? Now when I'm speaking.
There's a bit of blobbing that keeps interfering your audio, but I think what you are asking is you're not sure if your husband is depressed or not, and you are asking how you can help him because you're losing patience.
Yes.
Okay, I think I got that. Is he seeing a psychologist or a social worker?
No, we just saw a doctor.
Okay.
Yeah.
I think then my recommendation would be that you see the doctor, you ask for a referral to a psychologist, depending on the requirements of your medical aid. Some medical aids want you to have a referral from a GP before you go to a psychologist. And if that's not the case, then you can just directly go to a psychologist that is nearby where you live and have him be evaluated by one so that they can then determine whether there is a diagnosis for anxiety or depression or any other mental disorder that is happening. I think that it's quite important for you to offer your support in that way, for him to see a professional, because sometimes it can be quite hard for our family members to receive help only coming from us, and that a sound voice from a professional perspective might be of great help to them. So please try that.
That person is so difficult, I'm telling you. I don't know if it's only with men. He doesn't want to, even to go to a doctor, you have to push it.
Sure.
Yeah.
And do you have access to social workers where you stay? So, do you have access to social workers where you stay?
I'm not sure. Then I'll have to find out and see if they have anything.
Okay, I'm asking because social workers can come to you. So if maybe you're saying that
Oh,
he might not be able, he doesn't want to go out of the house, then maybe you can call someone in to just come in and try and speak to him. And social workers have the ability to come to you.
okay. Thank you for that.
All right.
Wonderful. Thank you. Thank you. I'm going to give us maybe one or two more questions. So I have a question here. How do I get a child to therapy after being in a traumatic situation, a family member passing? She tells you that she does not need therapy, but I can see it's taking a toll on her. She's 14 years old. At the same time, she will burst out crying and often tell you to give her peace of mind if she and often tells you it will give her peace of mind if she commits suicide. For someone who is not a psychologist, I'm unsure how to please advise.
Sure. So the threat to suicide is usually a threat that we must respond to quite swiftly, because you never know whether or not people mean it. We might think just because maybe she's 14 years old, she doesn't really mean it. And so I would really suggest that if you don't have, maybe take it to a general practitioner for them to do the assessment of a suicidal ideation, and then therefore the necessary referrals from there. However, I'm also cognizant of the fact that you said that she doesn't want to go anywhere. So I think beg her if you have to. Because I think it's quite important for her to be seen by a professional, especially if she is talking about getting a peace of mind and commit suicide. So I don't think that is a threat that we can take very lightly. Use whatever begging material or bribing material you may have to get her to be seen by someone, because I think that it's quite important that she be seen without listening to what she's saying. So.
Yeah, and maybe reach out to therapists that's good with teenagers, so that they can feel they connect with that therapist. Then will maybe motivate them to go back.
Yes. And I think the reason I'm speaking about a referral to a GP first, usually sometimes they might be open to the idea of being seen by a doctor instead of somebody who's going to be talking to them about their feelings and thoughts. And if they're not in a space where they are ready to discuss vulnerable feelings and vulnerable thoughts, they might be very hesitant or in fact, reject the idea of being seen by a therapist. However, a GP might be the people or the one who then convinces them that it's quite important that they be seen. And hearing it from them might actually be the thing that motivates them to say yes to the request and referral to a psychologist or social worker.
Yes. Here's a question. Can psychologists provide diagnosis for anxiety, or is it only a psychiatrist? Or a GP? Can a GP do it, for example?
So, they do them. They do give diagnosis of anxiety disorders, but I think it's quite important that we remember that they are not mental health practitioners. Even if they might have a scale, because sometimes there's like a quick 15-minute scale that they may have. So even if a GP does give the diagnosis of anxiety, I always suggest that it's important to then follow up with a mental health practitioner, which is a psychologist or a psychiatrist. And so, yes, psychologists do give diagnoses of depression as well as anxiety or any mental health illnesses, because psychiatrists are then the people who do the psych evaluation to check for the severity of the diagnosed disorder, to check if it warrants medication, and then they can give you the prescription for the medication. So I hope that answers it.
Yes, it does. Sorry, let me just. So is there no way one can assist someone who is suffering from HFA, but but they are in a denial. Wife and hubby, they don't want to seek help.
Yeah. There are, if even though I'm not like completely for them, there are quick quizzes online that you can find if you want to just quickly check how much symptoms or the presentation of symptoms you have. You can give it to them to do it quickly for them, and the answer for it will be there. So there's online ones, there's ones you can print out and take for them and just say they must just answer that. And it's usually present in a multiple choice questionnaire. Where they can just tick where they land, and then there's a score at the end that gives them, it's not a diagnosis of the high functioning anxiety, but it's just like an indication of the severity of it. And then they can take it from there if they want to then be seen by a mental health practitioner. So definitely there are quizzes online that you can find.
Thank you. Yeah, but it's again that thing, we can only lead them to the water. You can't make them drink. Thank you, Astini. It was such insightful. We learned so much. There's 100 more questions that will keep us here all day. So we really just want to thank you for all your information and your expertise today. And we want to say thank you to our participants today that came, that listened and stayed the whole time and really interacted with us. That is why we are here and doing these group discussions. We will again be having one next month in November, and then the last one for the year, early December. Thank you, everyone. Have a great afternoon. Thank you.
Thank you. Bye.
Goodbye.
You.
Thank you. Bye-bye.
Thank you.
Thank you very much. Bye-bye.